This podcast is intended for educational purposes only. For more information and our full disclosure, please visit NC-MIDWIFERY.com and our podcast page. Well, welcome back. We are back in Sunnyside with Dr. Stevens for more on this great way of having a better birth. Check it out. Hey, ladies.
Hey, we are super excited to cover a controversial topic and one that I'm really excited about, how all of the things we've talked about previously relate to labor, because that kind of is what we're all about, right?
Right.
So take it away, Angie.
Yeah. So if you didn't catch part one of the podcast for our on-site filming here, go back and watch it so that this whole piece makes sense. But we're going to go ahead and pick it up pretty much right where we left off last time. And so we were talking about how this whole system of care relates to orthodontics. And I was piping in. I'm going to say that I really, really hope that families that are watching will consider this system before you dive into orthodontics for your kiddos, before you make the financial commitment, before you, pull any teeth, before you do the orthodontic work. Yeah. Please give this system a consideration because as we talked about in the last episode, pulling teeth can actually make the whole scenario of a compromised airway worse and make some of their symptoms worse.
If you want to know the repercussions of it all, I had it all done to me.
Yeah.
The splitting my palate, the removing teeth, top and bottom, shifting them, and I'm still paying for it.
Yeah. So, as we were finding out and as we have found out in our own life, orthodontics can make your teeth straight, but it may not necessarily take into account the whole body and this whole system and the way moving your teeth is going to affect your jaw and your skull and the way it sits on your spine, which all affects your airway and the airways of your kiddos and creates all these symptoms. So for us, we wanted to avoid that whole scenario. We wanted to not pull teeth out of our little girl's mouth, even though she was having that crowding. And, some other dentists had brought that up. And you hear that a lot, right? When you're a parent and you're raising these kids and they have crowding in their mouth. I hear parents talk about this all the time and how, we had to go get these teeth pulled to make room for them as they're growing.
Kind of reminds me of I had to have a C-section.
Exactly.
Or I had to have my water broke.
Yes. Yes, exactly. And so I'm urging you, please take a look at this.
She's
Think
a little
about
bit passionate about this.
Think about it, because you may not have to pull those teeth. This is such a better, more gentle option, and it doesn't exclude orthodontics in the future, but it also tries to avoid creating a bad situation, making a bad airway even worse. So,
good stuff.
Yeah. We got rid of all of our
models.
Our models.
But you probably should reintroduce our special guest because we're not even in the studio today.
Oh, right. I'm getting ahead of myself. So for those of you tuning back in, we introduced our friend Dr. Stevens here.
Woohoo!
Oh, I think that was my fault. I was supposed to do that, wasn't I?
Oh, well.
Sorry.
It's okay. Neither one of you get any Lily's chocolate tonight.
Darn it.
I don't need any, trust me.
And so tell us just again a little overview of what you do and how long you've been doing it.
So this concept of airway we've been working with for probably 25 years. I've been in dentistry here in Sunnyside for about 45 years.
Awesome.
Amazing.
And things have changed dramatically since that time. And this concept that you're talking about, one time I remember taking first bicuspids out, 4 first bicuspids. We call it first bicuspid extraction for our orthodontist, so he could have nice straight teeth. And today, that simply is unacceptable.
Wow.
There is, in my opinion, rarely, I'll say rarely rather than never, a reason for taking out perfectly good bicuspids in a dentition that is somewhat normal. And
Yeah.
I mean, they don't have extra teeth or something of that nature.
Maybe you better explain dentition, because we have just moms watching our podcast mostly, and maybe they don't know what that means.
I don't know what that means. So, so
You're not
moms,
even a mom.
For
yeah,
Keith's benefit.
yeah, moms don't feel bad.
So in dentistry, we refer to the dentition as anything that's related to the teeth in the mouth and that arrangement.
Okay.
And to speaking to what you said about extraction orthodontics, we remove 4 teeth. The circle that holds the teeth in the mouth gets smaller. We only have, now instead of minus the wisdom teeth, we'd have 14 teeth there. Now we have 12 teeth in the upper arch. It's small. I have one patient, she's 50 years old. She is a train wreck. This poor, she doesn't have a life. She can't sleep.
Oh,
She wakes up at night. She's anxious all the time. And the reason she's anxious is because she can't get enough oxygen. She feels like she's suffocating half the time.
Wow.
She does not want to wear a CPAP for that exact same reason. And we're using our
I think that would totally just, I'd feel claustrophobic.
CPAP users are 30% compliant. And we have a lot of folks that will not use a CPAP. They feel that's just exactly the way.
So basically, they've gone through all the process. They have one, but they're only using it 30% of the time.
Right.
That's crazy.
Or 30% of the people are even using it.
Wow.
Oh, that's almost worse.
Yeah,
And
that's like the treadmill that was in our house.
Don't go there.
so that's it's fortunately it's become much less popular today. If I had an orthodontist that insisted on extraction orthodontics, I'd find another orthodontist. And I don't mean to cast aspersions at any of our fellow practitioners. From my experience and what I see, we are treating, as I said, train wrecks of people that have had these surgeries done and these extraction orthodontics done.
And I think just to maybe qualify something, because, you know, I think when we apologize for something that we specialize in, you know, because we don't want to offend someone else that's in, you know, in like practice, what we're saying is that because of our specialty, right? Like I've specialized in things before, and you'll be with someone that doesn't specialize in it. And you just want to look at them and go, hey, I can't recommend that because I have this information. And it's been fascinating getting this information.
Yeah.
Because in reality, there's people out there that are going to make a decision differently now because you're educating them.
Yes.
Right.
That there's something beyond just what we typically hear about, which is dentistry and, you know, appliances and things like that. Now you're talking about reshaping the mouth. That's incredible. And growing bones. That's
Right.
awesome.
Right.
And I will tell you that when I talk to some of my friends that are orthodontists,
Yeah.
and I love these guys. I mean, one of them I refer to, we're working with patients together. And when our son Aaron and I went down and talked to him about this concept that we were going to use an epigenetic appliance to grow bone, and that we'd like to have him chime in later with some orthodontics as necessary. When I said that we're going to grow bone in a person that's 40 years old,
Yeah, exactly. The lights went out.
It's
Yeah.
like the word that was going through his mind is one we can't use here.
Yeah, you do. You just bleep it like Gold Rush.
So that's it's similar to the fact that we were just talking that these, what we know, these sutures, these seams in the skull that you've seen in all skulls, that many practitioners feel that these are fixed. They don't move.
Right.
On the contrary, these do move. And I don't know
Yes,
any
they do.
chiropractor that will tell you that these don't move. And we have
Right.
seen this. We've demonstrated it.
Right.
My son and I have done some things that are, I think they're unique in the dental and craniomandibular field that could help people that have TMJ issues, if you know of any.
Not me.
Not me. No confessions here.
Not me.
I run the confessional. Okay, I'm the one that confess. I do not have TMJ, but I do think I have sleep apnea.
Okay. So I just want to touch a little bit more on this orthodontic piece. So tell us a little bit about that concept that not all orthodontic work takes into account what's happening to the rest of the jaw and the body when you start pulling teeth and, forcefully moving these around in your mouth.
Well, there's a couple things that take place there. One is that when you take out teeth, the teeth that are taken out are the bicuspids, which are the first bicuspids, which is that tooth and that tooth. So now we have a hole right behind the canine teeth, and instead of moving the molars forward, which is more difficult, we move the front teeth back. So two things happen there. One, this circle gets smaller, so the airway is going to be smaller. The nasal passages, which wherever this goes, if this gets smaller, this gets smaller. So the nasal passages get smaller as well. And when that happens, the whole airway that comes down here gets smaller. And now we have a complication that this child already had a complication of airway,
Right.
because the palate was too narrow. Well, now what we've done is we've pushed it back. And then the other thing, and you'll see this with some patients, their lip, instead of how it should be, tilted out like this, is tilted in like this. It should be at 90 degrees to what we call the cranial base, and which puts it right here. Instead, it's sometimes it's 78, 70 degrees.
Right.
And this is not conducive to good orthopedic structure. So we have a young boy here that we used this appliance. Oh, another thing I was going to mention is we reduce this airway. So here, genetically, we're supposed to have an oral cavity like this. It goes into an airway that's this size. Now we've done our removal of teeth for orthodontics. Now we have a mouth that's this size. We have an airway that's this size.
Yikes.
Wow.
That's
And I
so
will tell
sad.
you that I've seen these and I see these in adults. I don't know how they're breathing. We had one of our patients, he was 66 years old, and great guy, love the guy. He's from Chelan.
Man.
And kept telling him, John, you need to get in. Let's get going with this. And yeah. Well, finally, September a year ago, we had him scheduled for Tuesday, but he died of a heart attack on Saturday.
Wow.
And there's no doubt in my mind he died of obstructive sleep apnea.
Wow.
Yeah, it's interesting. We lived in Denver for a short period of time, right? And everybody talks about athletics in Denver, Colorado because of the atmosphere. And I mean, I've been present and watched athletes play, seen them on TV, and they would come to Mile High Stadium and play against the Broncos. And these grown men, you could see that they could not get. It wasn't just the altitude. You could tell that they were, they struggled normally because they're big men. They couldn't breathe. You'd watch them on the sideline with oxygen. And I can only imagine what this causes from a baby on in the impact
that's so
and what it
sad.
does to your heart. So
Amazing.
Exactly.
Awesome.
So we have this little guy came to us, great kid, great parents. And so his teeth look like this. If you can focus in on that and see his front tooth is totally tucked back in on the left side. And I'm going to say, I'll say 6 months. I don't remember exactly what it was. It wasn't a year by any means. So in about 6 months, we took another impression for him, and this is what the results were.
wow, before and after.
Yeah, he was smiling.
It's
Praise
His
God. I
personality
love
changed.
it.
That's
it's just
awesome.
wonderful. And this is without pain.
Yeah.
This is not a traditional set of braces or cranks that are forcefully forcing these things apart. This
And
is
that hurts. The
you know,
other way hurts.
Oh, it's so painful. It's just miserable. And this is without pain because, again, you might have to look into what epigenetics even is to understand, this piece of it. But by stimulating your own body's growth system gently, and it just kind of tells it what to do and what to grow.
Sounds awesome.
Yeah.
Is there a reason why this is not heard of today and it's not common? Has it been something like chiropractic care has been in the past where it's just kind of considered fringe medicine? Because
Well, it's
obviously,
kind of leading edge. It's like
is it
new.
modern? Is it modern? Is it something new that's this?
It is. So to give a number, this formula for this, Dr. Singh actually popularized this more than anybody. It was out there. And so, say 20 years ago.
Wow.
Well, it was in its infancy. And so it takes it a while to catch on. It's not taught in the dental schools.
Right. Wow.
The dental schools tell you that you can't grow bone. I learned that.
Yeah.
You can't grow bone.
Right.
So that's stuck in everybody's brain even today. And so this is hocus pocus.
Yeah.
So it's
Hocus
not.
pocus works sometimes.
Yeah. So
Well,
it's-
clearly these models are showing us it's
Yeah.
not.
Yeah.
but the dentists don't believe that.
Right.
Yeah.
So it takes a while to catch on.
Yeah.
So Dr. Singh, we actually started with him in his group called Biomodeling Solutions. And he and our son who actually worked here doing diagnostic analysis for cases that they would send to our office. And he decided he wanted to expand this. He's had a great deal, he had a great product, but it wasn't out there. It was just a small group.
Right.
So he got together with a guy named Kirk Huntsman, who's just a terrific guy. And Kirk and his son Todd formed this company with Dr. Singh called Vivos. And these two guys are business people, but they appreciated the science of what was going on here. So they did not prostitute the science of this appliance, as happens so often. You find it
Right.
on Walmart. This appliance cannot be used unless you belong to the Vivos group. And they've protected the science of this appliance.
So it's used. So, and the reason for that is to use it correctly and not just have it something, because if you don't have the right use of something, you don't get the value out of it.
And especially for this.
Yeah.
And this can be misused.
So is there a web page for, how do you pronounce it?
Vivos?
Vivos? Is there a web page for that?
Yes.
We can put up? Okay. So we'll put that up here on the screen.
Yeah, we're going to have all kinds of contact info for you guys to be able to follow up on this.
This is good stuff, Angie.
Yeah. Yeah.
So I am dying to know, how can this relate to labor?
Yes, let's move
I'm having a
into
hard
that so
time.
that people can
The midwife
have their
wants to
curiosity
know.
What
satisfied.
wants to know?
How can chirodontics help your labor?
So within all of this, it's all related to the same philosophy. And essentially is that we have a gene, the body is perfect. The human body is perfect. Well, people can argue that it is or it isn't, but that's my premise, and that's the way I approach my field of healthcare. And that when things are altered, we have a push or a pull, the body is going to compensate. And we do a great job of compensation. And what we want to do, as far as I'm concerned, is we want to let the body tell us where the balance point is. Gravity is king or queen.
I won't say it.
Good catch. Good catch.
I won't say it.
And so we want to be here. We want all the platforms perpendicular to that. And this lower jaw functions like any other lever out on the farm. It functions by this exact same set of principles of physics. And sometimes that's not realized. So in looking at that, when we approach this concept of labor, well, labor is a very natural thing too. I mean, this is just something that should be very, let's take away all the things that could obstruct a natural labor.
Right.
And so one of the things that obstructs a natural labor is if this is not in balance. So if this cranium is perpendicular to the lines are parallel to the lines of gravity, and yet this upper jaw, this maxilla, is tilted, because it can be tilted in the cranium. This will be this way. This yellow maxilla or upper jaw is this way. So don't lose your head.
I need an extra one.
It's just a model. It'll be okay.
So if the upper jaw is tilted, then obviously the lower jaw is going to tilt along with it.
Right.
That makes sense. And so if it's tilted, it's not in alignment. These are very important. The body's really concerned about this because this lower jaw has a function that are three very mildly important things of chewing, of swallowing, and breathing. So the brain, the subbrain back in here is going to make sure that everything is compensated for properly. So a lot of energy is going to be thrown there to keep from anything being damaged because this is out of balance. So what we do is we watch this jaw move through space and we catch it when it's going in this vertical position, and the upper jaw may be like this, but we catch that lower jaw before it tilts off to the side. And then what we will do,
Oh, I'm a mess.
what we will do
The jaw is a mess.
we will catch that jaw into the right position, and we'll squirt some gooey stuff in there that sets up, and we'll capture that.
Okay.
And we'll do that 2 or 3 times. And from that, then we'll have a bite registration that's like this. We will test this with what I would call kinesiologic testing or muscle testing.
Cool.
Yeah.
And we will find the right bite. And I will tell you that when I am looking at these, and I'm looking at that bite, and I see this patient moving through space, and I'm trying to find that spot, and we're talking within a fraction of a millimeter.
Right.
And I can't tell sometimes the difference between the bite. And we'll do 2 or 3 of those, and then we'll have the patient put the little bite registration in and put it in. We'll test them, teeth together, pretty weak. Put the bite in, a little stronger. One of those bites, they'll be solid as a rock. And I'll tell you, I can't
Nice.
tell which
Love
one
it.
it is.
Yeah.
If the dentist chooses the bite, it's 50% of the time it's going to be the wrong bite.
Wow.
We
Let your body choose.
took the words right out of my mouth.
There you go.
I love
Means
it.
we're on the
I have
same
to
page.
Interject something here.
Okay.
Do you know about the concept that what happens up here and the tension up here and the alignment up here affects the perineal floor?
Pelvis, yeah. A lot of that has to do
So
with the connection. We address that. And so this pink bone in here, that's called the sphenoid bone. Well, the importance of that, and the name doesn't matter, but the sphenoid bone is the centerpiece. That's the gyroscope of the cranium. And it's the only bone in the cranium that touches all the other cranial bones. So obvious, if that does anything, it's going to affect everything. Well, interestingly enough, this upper jaw that's affected by our little appliance here, wherever it is, that's affected by our appliance is the only bone in the facial bones that touches all the other facial bones.
Wow.
interesting.
So this is going to affect this, and these two touch right here. And we use that to align the upper jaw and determine, and that's what we do, is we use that junction there to determine where the proper alignment of this upper jaw is in relation to the cranium. It gets a little out there, but
And this affects us all the way,
Way down. Yeah.
the connection to this to pelvic tilt is well documented, and a lot of it has to do with this little caudal part of the sphenoid bone. It's a little cartilaginous area there. But
Just to recap in layman's terms, so the way that this can help your labor is it kind of in a similar fashion, right? That chiropractic care can affect your labor because having your body in the proper alignment allows it to work the best, allows it to move and jiggle properly the way that it needs to.
Jiggle.
That's whatever, whatever.
Jiggle.
That's the primary thing. And it also affects this oxygen piece. You're getting the proper oxygen intake, which also allows your brain to relax. Because even when you're in the middle of labor, breathing is going to trump the labor process. Like your brain's going to be concerned about you getting oxygen before it's going to probably be concerned about getting this baby out. So it's going to affect it that way too, and allowing your brain to relax so that then you can focus on this whole other process that's going on. And the way that happens is by coming and getting fitted for the appliance that we just showed you here, and putting the jaw in alignment where it's supposed to be in relation to the skull and the rest of your spine and your pelvis and so on and so forth.
Sign me up.
I highly recommend it. And I can tell you from personal experience that this is something they also use in sports and a lot of different things. But I've used this. I've tried this appliance on. And just like with the kinesiology, there's different ways to test this. And so, you do the bend over and touch the floor. How far can you go? Then you put this appliance in, you bend over and touch the floor. And
you just sound like a nut right now.
Well.
Yeah. Well, hey.
You just gained 2 inches of stretch with this appliance in. Now think what that can do to your labor. If you just gained extra movement in your pelvis, that's huge, you guys. It's going to make not only for a physiologically smoother labor, but I think also a more peaceful, less anxious
gonna
labor.
Be happier with optimal oxygenation.
Yeah.
Also.
Absolutely.
And besides, I think it's just a lot of passion and wisdom with just a touch of nuts.
Just a touch.
Because you can hear her passion. This is awesome. And you've tried it.
I've tried it.
Yeah.
I didn't try it for my labor, but I have tried the appliance, and it is a little bit out there, but I think that's just because it's new. I mean, chiropractic care is out there. Kinesiology is out there. It's
homeopathics.
But that's what we're here to do, right? Is this alternative natural health care.
Or nuts in general, so it all fits.
This is the piece that we use. This is an older one, but it's designed so that it's not quite as obstructive, so it allows more area in the front there, so that breathing's a little bit more easily done. And we use these, as Angie said, we use these for athletics. We have Olympic athletes that use these. You may remember Apollo Ono. He used this. He said every high school, college, and Olympic facility ought to be using these for their athletes. And as Angie aptly put it, so these athletes use it in all the motions they do, and their performance is better. And as she said, certainly the performance of the pelvis is going to improve as well. That's a great point.
That's awesome. And guys, we're not trying to drum up business here at all, because these guys
come in
are
as often
busy.
as you want.
Yeah, but come in as often as you want.
These guys are busy, but they have such a passion to help people improve their quality of life. And we've kind of jumped onto that passion because it's infectious and it's wonderful. And we just so believe in what's happening here. So I really urge you to check it out. We promised you the labor piece. We also promised you the mask piece. So we're going to give our little 2 cents spiel about
feel
this.
Feel free to just be honest.
Be honest. Yeah. So Dr. Stevens, in your professional opinion and experience, and I know you've been doing some research on this lately, why should parents think twice before putting a mask on their kid?
Well, you think about it. Now, we just talked about labor and all the natural things we ought to be doing. Now, just think about how natural it is for your child to be going to school and wearing a mask all day. In my opinion, this is child abuse, and not political. This item has been made political. That's the political science. I'm talking about the biologic science. I could care less about the political science. I see kids all day long that are of obstructed sleep. They have their brain fog, all the things that Angie mentioned here. They're not learning well. They're not sleeping well. They're wetting the bed. And now you're going to inhibit their airway even further with this mask. Close down their nasal passages so they don't get the amount of nitric oxide that they should be breathing in that are going to help dilate their vessels and dilate.
Right. But so obviously the reason is they're trying to slow the spread of, the diseases that are out there. But in reality, you're saying as a professional that you see the negative results from this in your research.
Absolutely. Yeah. And these kids, their chances of getting struck by lightning are greater than getting this virus. So here's...
Go Go doctor.
So if they're wearing a mask, it's akin to, and I've played the numbers, the size of the largest virus and the smallest mask size, and it's like putting up chicken wire to keep the flies out of your yard.
Right. It's only going to, it's not going to make as
I
much
like that
difference
one.
as it could make negative impact, as you're saying.
And exactly, not only physiologically for these kids, because they're not getting the air passage.
Right.
Their little physiologic system now has an epigenetic factor. And this epigenetic factor could potentially, and I don't know that anybody's done this study, this hasn't been out long enough.
Right.
But I think we can theorize it's going to affect them and their genetic development. So they're going to end up with a biochemistry that is flawed because of wearing this mask.
Right.
Additionally, they're going to have some sociologic, psychologic issues because they didn't give somebody this feeling that I accept you.
Yeah.
That you're really a good kid. They can't see. They don't know.
No
they
hugs,
are
no
developing
smiles.
that. Oh, it's
Right.
horrible. It's absolutely criminal.
So how do you feel about this?
I actually wasn't going to say this.
I know. It's
I told him to go for
it's
it.
like the lion is here, right?
Well,
it's awesome.
Yeah, some passion.
You know, when you see little kids
Yeah.
that are, I see adults. This woman I told you, she
Right.
can't breathe. She's suffocating. Her life is a mess, and she's a wonderful human being. And when you see that, and then you look at little kids that are this wonderful little piece of protoplasm,
Right.
and now they're breathing through their mouth. Their tonsils are getting bigger. Their adenoids are getting bigger.
Right.
They have brain fog. Now they're having their adenoids and tonsils taken out,
Right.
and they're given a medication for ADD, which has gone up to $1 billion business for kids at 4 years old.
Yeah.
What is it? 1 out of every 3 kids are on a medication.
Well, and so one of the things that I've noticed, and I've tried to watch this as an observer over the last year, and one of the things that you hear is in the medical community is that there's certain people that are advised that they don't have to wear a mask because of medical reasons. And so at least the world is smart enough to know that medical reasons are a reason. Now we're discovering what you're saying is more medical reasons because we're starting to do research and doctors are starting to step up and people like you are starting to speak out and saying, hey, there could be something long-term that's impacted, not only just short-term, like this lady you're talking about that can't hardly breathe, or the lady you talked about that leans forward because that's the way she has to lean forward to get air in and out.
Yeah.
Now we're actually talking about the long-term impacts that could happen because
a temporary thing. This is affecting.
and I think that's, but so, and we're not just picking, I think on masks here, we're picking on some of this just lack of knowledge and even having a better birth because of what you've experienced, Angie. So the masks and this whole concept and this thing that you're educating us on is a way for us to realize that we could change our lives for the better if we realize the long-term impacts. And masks have, obviously, will have a long-term impact the longer we have to wear them. So,
and you have a study here, right, that we can post for people?
And this is a study that was put out by the Association of American Physicians and Surgeons. And this is a lengthy article. And in here, they document studies of where this has taken place. And they also have a graph here that I thought was pretty interesting. Was here's the height of the virus infection. It dropped down, and now they instituted mandatory masks,
and it's going
and
up.
then went back up.
yeah.
And you won't find these on Google. They will disappear. I have seen some wonderful 40-minute.
They might make us disappear.
Well, I don't know. I think we have to stand up as American citizens. What's happening is we're being oppressed, and you should not be. You should be able to express your opinion and your science without being politically.
But this is real stuff. You've experienced this. And that's why we're here. That's why we're on location. And that's why we're talking to you.
Yeah.
Because we want to hear from someone that's really dealing with this on a day-to-day basis. And it's fascinating to me.
This has been awesome.
And Shannon realizes now that she should have met you a long time ago.
I'll be back.
Shannon needs help. Well, you guys, thank you so much for listening and tuning in. I hope this was helpful. I really, again, just so strongly urge you to check out the links that we're going to post. Check into this information, see if it's something that could help you or your kids or help them avoid problems in the future. And stay tuned for us for a little post-episode bonus because we're going to follow Dr. Stevens back into another part of his office and look at some real skulls and see some real airways.
So if anybody has questions that they would like to ask specifically that we might need your input, is it okay for them to reach out to us?
Absolutely.
Shannon, where do you want them to email the questions to?
To our website, nc-midwifery.com.
And it's right here on the bottom little screen. And we'll try to forward those questions. And obviously, to a limit, you may have to come see him or someone he would recommend. And you can make recommendations even in other states.
Yep.
If someone's great.
We have dentists all across the United States.
Awesome.
It's awesome. Yeah.
Well, we will be back with you guys later.
Thank you guys so much.
Well, that's a wrap on another episode, all the way here from Sunnyside. Thank you, Dr. Stevens. That was very educational. And to Shannon and Angie, that's a great episode. This podcast is intended for educational purposes only. For more information and our full disclosure, please visit NC-MIDWIFERY.com and our podcast page. Don't forget, we want to invite you back for our bonus episode 1 week from today on March 9th. We'll see you then.